Hi everyone, this is Dr. 𝒊𝒂𝒂𝒊𝒂𝒍 with Greenwich Chiropractic, and in this video series we're talking a lot about sciatica. Now we know that there are many different causes of sciatica. It could be stenosis, it can be a disc, it can be a muscle, and so for this reason when we go through our exam there are some very careful tests that we do in the office to determine the cause of the sciatica and to determine whether or not you have sciatica. So here are 3 tests that we do in the office to help determine whether or not you have sciatica. The first one is a very simple one. It's called slump test. So what I'm going to have Tomas do here is he's going to slump down, and then with his right leg I'm going to have him bring it straight out in front of him, toes up towards him. If that reproduces sciatic symptoms, then we know that most likely he has sciatica. We're going to do the same thing on both sides to determine which side is worse and contributing more to the pain that you're experiencing. The next 2 are going to be ones where we're lying flat on our back. So I'm going to have Tomas lie down. And this second test is called straight leg raiser. Basically, the goal of this is to supply or add tension on the sciatic nerve. And if it increases his symptoms, then we know he has sciatica. So very simply, I'm going to anchor the top of the hip and lift the leg up, checking on the patient to see where we find that piece of tension in there, okay? And we're going to do that on the side where he's having numbness, tingling, pain radiating down. If that reproduces or increases pain that he's been experiencing, that's a positive test. The second one is very similar, but we're actually going to use the opposite leg. So the leg that's not feeling as much pain or tenderness. And what this does is it helps us localize where on the back the sciatic nerve might be impinged or inflamed. So same thing, I'm going to anchor the top of his hip. I'm going to lift his leg all the way up until he starts feeling pain, checking on him, and then back down. That is also a test that can be positive. If it reproduces pain on the opposite side, we know that's definitely the leg that's involved, and that's where the compression is coming from when it comes to a case of sciatica. So because sciatica has so many different causes, it's really important that we focus and do very careful examination and testing. Thank you so much for listening. We'll see you on the next video.